What?
All right, I'm going in. If I tug on the rope twice, that means pull me out.
So, Doc, I figured if Charmise and I are going to live as man and wife, I ought to get her checked out.
Of course.
What? This is a very inappropriate, weird situation. You actually wouldn't put the patient in stirrups like this, and most likely they're facing the door. So if somebody accidentally walked in, they're just, everybody sees everything. You wouldn't do that. It'd actually be turned around. They're in what's called the stirrups. The stirrups basically change the angle of the pelvis. The reason why you actually have the angle of the pelvis change is because of the uterus, the organ that you're looking at. You're looking for the cervix. You're trying to feel the uterus as well as the ovaries on each side.
Charmise, when's the last time you had a pelvic exam?
When was the Missouri Compromise?
Yep, there are definitely scheduled times of when somebody should be getting pelvic exams. The frequency just depends on your activity and age. But in the emergency department, we do them emergently. Typically, if somebody's having a significant amount of vaginal bleeding, if there's vaginal discharge during pregnancies, or if there's any pain or injuries down in that area as well, we'll do pelvic exams.
I think 1821.
Then I've never had a pelvic exam.
What?
All right, I'm going in. If I tug on the rope twice, that means pull me out.
The rope is inappropriate, but it's putting on a hat that has a light on it. It's quite helpful in certain situations.
God, who are the pigs who just throw their empty beer cans down here?
If you're having any procedure where you're going to get that significantly close, you should be gowned up, wearing gloves, depending on the sterility of the situation that you need. Does it need to be clean versus sterile? Oh, wow. He walked and snapped his bone, and it's tenting through the skin. It didn't pop all the way through, so it wouldn't be called an open fracture. It's still a closed fracture.
Holy crap, Brian, you okay? How's it look, Doc? I'm sorry to say you have hip dysplasia.
What's that?
Oh, hip dysplasia. So it happens with dogs, typically not seen in human beings. Brian's leg is potentially shortened and externally rotated. Depending on where it's broken, the orthopedic surgeon will use different types of hardware or metal to reattach basically your leg to your pelvis.
I'm not sure what dysplasia is, but I do know you don't often see a Y that far up in a word.
There are some times when a doctor may not know the exact origin of a medical term, but hip dysplasia is basically a term that we use relating to the abnormal growth and some gentle abnormalities relating to the hip, which then could lead to fractures, dislocations.
I took the liberty of x-raying my own hip to show you what a normal one looks like. Why does it look like there's a Batmobile in your colon?
That's good. I've seen plenty of unique objects that have been lodged up in the rectum. Typically, it's just your standard light bulbs, scotch glasses, but nope, actually not one of these cars.
Wouldn't hurt to lose some weight. And he won't be able to walk until his hip heals. He'll need someone to take care of him.
I'll take care of him. Like you took care of me when I was sick.
The reason why we say weight, because you have more weight on the joint itself, and it's just putting more stress and strain on that joint. You know, the bodies are not made to have excess weight on it, and that's why you get concerned with somebody's weight, not just from diabetes, metabolic syndromes, cardiovascular disease, high blood pressure, but even just your joints, arthritis. You know, the more weight, the more it's going to hurt when you actually have inflammation of the joint itself.
Come back in a week. We can check your... What is that? That's the sound a blood pressure machine makes. I do impressions for the Doctor Talent Show. Do you know what this is? Rap, rap. An MRI? Yes! Adding that to my set.
I mean, I've actually had an MRI done on my ankle when I was playing soccer back in the day, football for every international person out there. But it doesn't go rap, rap. It goes like clank, 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 clank. Changes up their frequency. Literally, you're in there just like listening to the banging noise as you're trying to listen to music and relax.
So, Doctor, is Peter healthy?
My goodness, you'll be dead within a month.
Dr. Hartman is using his stethoscope to listen to just the abdominal noises and sounds. What you're listening for is basically to hear if there's any movement or not movement. You know, listening to somebody's abdomen and then saying they have a month to live. Yeah, I wouldn't listen to that, doctor.
Mr. Griffin, you're going to expire in a month. This is your driver's license, isn't it?
Oh my gosh. You can have labs that show that you have renal failure, that if it's not fixed, you can die soon because of abnormalities of electrolytes that might then cause you to have cardiac arrest. Unlikely that a blood test is going to tell you that your existence is not going to continue after a month.
Now, Mr. Griffin, that liver's got to come out.
What?
It's been in the microwave for 3 minutes. It'll get dry. Now.
Please.
Just focus, Dr.
Please.
Hartman.
We can't take any more shtick. Please just tell us, is Peter healthy?
Oh, yeah, he's fine. He's just really fat.
Oh, thank God.
Wait, hang on a second. Did you
Yep.
just say I was fat?
Well, yeah, you are pretty fat.
Okay, this is news to me.
Excess body weight can lead to metabolic syndrome, which then can lead to diabetes, hypertension, cardiovascular disease, a whole plethora of problems. Nice.
I notice your kid is having some trouble.
I get a question all the time, you know, what is the right age to start working out? Is it going to stunt my growth? Is it going to cause injuries? You should work on technique using body weight first and then getting the techniques down, and then you can slowly start adding weight as you get better at the movements, because you don't want to, you know, get into bad habits, put excess stress on your joints because of the growth plates itself, and, you know, causing potential injuries to those areas.
You're telling me.
Oh, your kid just needs a little help. I got something that'll get him going.
Oh my gosh. At least they labeled this weird open syringe as steroids. And we actually use different types of steroids at the hospital, but we do not use what's called anabolic steroids, which are the steroids that make you, you know, big muscles. You got to be really careful with those because they have a lot of side effects. They're replacing your own natural steroids that you're making in your body. And it doesn't strengthen your tendons. It just strengthens your muscles. Your growth of your muscles may increase faster than the strength of your tendon and your connective tissue. So you have to be really careful, and that is why people sometimes have an increased risk of tendon ruptures when they're actually using steroids.
Here, Stewie, try this. Yeah, what the hell are you doing? Whoa, suddenly I'm full of energy.
A lot of people assume medications that we give will work immediately. You know, sometimes we'll give somebody a sedative. It typically still takes like 30 seconds for it to work. And it also depends on the route. IV is obviously faster. IM is a little bit slower.
Hello, family.
Look how jacked he is. It's huge. If I saw a kid that came into the emergency department that was like ripped and jacked, I'd be super concerned and maybe get social work and case management involved just to have conversations with the family on a different level. These were hilarious. It touched on so many different sensitive topics, but they added an extra fun twist to it, which I enjoyed, and I hope you guys enjoyed. We still have limited merch running, so check out the link in the description below to get your Dr. ER merch. Check out this playlist right here. Make sure you binge watch everything. And I appreciate it if you hit that subscribe button, turn on your bell notifications, and hit that like button. Thank you so much for watching, and stay healthy, my friends.